All right, so we just finished your 33rd TMS session, I think. So what were you like before you started these treatments at Ascend?
Previous to coming here, I tried many medications, and specifically over the last 7 years, my depression kept getting worse and worse, and I kept failing medications, and my affect was flat. I did not find joy. I sometimes spontaneously cried, and I was suffering with depression and anxiety.
And one of the things that led us to say transcranial magnetic stimulation might be a good idea for you is that a lot of times you'd have strange side effects of medications too.
Yes. The most frequent side effect was after taking it for a short period, I would have cognition issues where I couldn't think as well as I used to, wasn't as smart as I normally was, and was making mistakes and was confused.
Sure. And with TMS, a lot of times patients report better cognition regardless of whatever else the effects are of it. So what are you like now?
I'm much better. I actually, within a few treatments, said out loud, I've got my vocabulary back.
Great. And then the depression's a lot better, where I'm sure you still have bad days like we all do now.
It's much better overall. I find that now if I'm watching a comedy, I actually laugh. I find more joy. I find more reasons to smile every day.
Right. And here at Ascend, we always think that getting your joy back is actually something that's often overlooked, as opposed to, I don't want to be as sad anymore.
Right.
So the interesting thing with you too, when we first started talking, this was probably 2 months ago or so, is that we said in your case, it did seem that there was some neuroinflammation, where it wasn't that your brain was sad, so to speak, or some sort of neurotransmitter issue, that it seemed to be a whole body thing. So you are a case study where there's a lot of data on triglycerides improving when you get adequate treatment, all these markers that otherwise the body's just sending all these chemical messages saying we're inflamed and we're not happy about it and we're going to let you know about it.
Right. I do have inflammatory issues, and it makes sense to me that if my body, my joints, my organs are inflamed, then my brain also would be inflamed.
Right. And it's interesting too, because we mentioned in your case, ketamine combined with TMS would help a lot. But what we like to see in patients is where they say, oh, you know, I could do this too, but I'm doing great. Just the ability to not get the kitchen sink thrown at you is something that I feel is very positive.
Right.
Since we often find patients in survival mode, it's really nice to get out of that and pick and choose what makes the most sense for you and what you really need.
Exactly. I'm happy that I have made marked improvement and that there has been a big difference.
Mm-hmm. And then the other thing that's been really fascinating with you is that we were hoping that your blood sugars would improve, since we felt that with you a lot of this was inflammation, which is also easier to say because then we can say, if you're depressed one day, well, it's a flare-up. Like, we can use physical terms to describe it instead of, oh, it's just my brain doing this or that, and the frustration that comes with it when your brain won't do what you want.
Right. So what's interesting is I do wear a continuous blood glucose monitor, and from the very first day, my glucose started dropping and it was going low, and I'm a diabetic that takes insulin. I adjusted my glucose within that month period from 44 units down to 32 units.
And there's probably some caveat. I should say that we don't recommend our services for control of diabetes or cognition. You know, this is something that insurance will pay for if you've failed a few antidepressants. But it's nice to see that the latest research on depression being something that doesn't just involve your brain in an isolated instance is showing that, you know, whether we're talking about metabolic psychiatry or chelation or some of these other aspects that kind of surround your experience, it's kind of neat to have the actual data to show that it's working for you.
It's something measurable instead of just my opinion.
Absolutely. Well, thanks for sharing today.
Okay.